I'm Sherry Whitworth, the Managing Director of Advocacy and Public Affairs for FiscalNote. FiscalNote and our team of reporters and editors at CQ Roll Call are actively monitoring the coronavirus outbreak and the effects it's having on our politics, policy, our customers, and the industries they serve. To see the most up-to-date and comprehensive monitoring of the virus and how governments in the US and in Europe are responding, please visit coronavirus.fiscalnote.com. We've made much of our coverage there available free of charge to help you navigate through the crisis. If you can also sign you can also sign up for our daily newsletter and learn more about how FiscalNote can help your organization monitor the politics and policy around COVID-19. Again, if you're interested, please check out coronavirus.fiscalnote.com. Today, I've got just a few quick housekeeping items to cover before we get started. In the right-hand corner of your screen, I believe, you can see and use either of the Q&A or the chat buttons to submit questions throughout the webinar. Please do that at any time. We want to make this as interactive as possible with this particular technology that we're using, so please do ask your questions and we'll attempt to get to as many of them as possible during our 1 hour together. The session's also being recorded, so afterwards you'll be sent a copy of this event via email. Everyone, as you log on, should be in mute mode, but if you're not, with the exception of our panelists, we ask that you please ensure that you are muted throughout the event for the benefit of the whole audience. Today, I'm joined by 3 industry experts who are going to help guide our conversation and answer your questions. Just so you know, we're all coming from 4 different locations, so please excuse any kind of slight variances in the sound quality or any slight pauses as we go through our webinar. First of all, he is Vice President of U.S. State Government Relations for Johnson & Johnson. He manages the corporation's state legislative and regulatory team across the U.S. and Puerto Rico. He's a member of J&J's Government Affairs Global Leadership Team, which is responsible for setting the function's strategic direction. Next, we have Sherry Dexter. Sherry is the Director of Political Action for the American Hospital Association, where she runs all aspects of AHA's Political Action Committee. Sherry's an expert fundraiser and organizer, and I've known Sherry personally for more than 15 years. I know her to be a pioneer and a creator, one who embraces change and makes things happen professionally and personally. So I'm really excited to hear how her take on applying that zeal to the current environment at AHA and other things that she's doing. And thirdly, we have Michael Drobeck with us. He is the Senior Advisor for Federal Affairs at McGuire Woods Consulting. There he helps clients from the tech and telecom space develop messaging and define and execute strategies while advocating before Congress, federal agencies, and others in support of policy objectives. Michael has been involved in something called the App Coalition, and that is representing interests of small and medium-sized app developers. So that's unique. Thanks all panelists for joining us. We want to just set the stage a little bit, thinking about back to the beginning of 2020. Here in the US, there were whispers of a pandemic in China and other parts of the world, but for the most part, the US was business as usual. And then bam, the middle of March hit. We were under a shelter at home. The world was in a pandemic. All non-essential businesses were shut. Millions of people were unemployed, are unemployed. More than 100,000 Americans have lost their lives. Supply chains are stymied. We have trillions of aid flowing in from our government. And now, after about 10 or 12 weeks, slowly one by one, the states are reopening for business at various levels. So with those kind of things in mind, we want to think about and ask each of our panelists, how has your organization changed since March? And we're going to go first to Chris Lepore, then Sherry, and then Michael. So Chris, thank you for joining us, first of all, and could you just kind of tell us how your organization has changed since March?
Yeah, thank you, Sherry, and my thanks to FiscalNote CQ Roll Call for hosting today's webinar. A pleasure to be a part of it along with my fellow panelists. Maybe just real quick, I think many people are aware of who Johnson & Johnson is. We are the world's largest healthcare products manufacturer. We manufacture products in the consumer health product space as well as medical and in pharmaceuticals. In the pharmaceutical space, we are one of a number of companies that currently have a coronavirus vaccine in development and are working to hopefully bring that to people not only here in the U.S. but around the world in the near future. Our U.S. State Government Affairs organization is composed of about 20 plus in-house state government affairs professionals who have a long tenure in the industry. I would say that our organization itself hasn't changed really since March, but the priorities have certainly shifted, and how we work has no doubt changed and been impacted by the pandemic. Our priorities went from advancing proactive patient access legislation and defending against anti-industry proposals to really being committed and committing significant time, resources, and energy into state and local executive orders that impact our U.S. facilities, our operations, our employees, as well as the people and patients who use our therapies and medical solutions. To a large extent, we have for many years focused on state government, and what this pandemic has done for us is required us to sort of flex and grow new muscles in local government, because just as there have been a significant number of state executive orders that impact our facilities and our employees, people and patients who use our solutions, but local governments have also been very active in how they are addressing the pandemic. And so our team is responsible. Individuals have responsibility for representing the corporation, all of its functions in anywhere from 1 to 3 states. But we have many facilities across the U.S., make facilities, deliver facilities, business operations that have been impacted. And so that has been one way in which we've had to change the way that we operate. And then I would just say that how we engage, inform, and attempt to shape the process has also had to change. Like many organizations, we're utilizing virtual meeting platforms and hosting and participating in online discussions, but also deploying digital and social initiatives in ways that we haven't had to in the past, or that we didn't but wanted to, and now the circumstances demand that we do. So hopefully that gives you a sense of some of the things that have changed for us over the course of the last 3 months or so.
Thanks, Chris. Sherry, we want to pivot to you. You run American Hospital Association's PAC and political action activities. How has what's happened in the last few months impacted AHA? I mean, you represent the hospital, so give us the insight there.
Yeah. Sherry, thank you so much. I really appreciate the opportunity to partake in this webinar, and I'm honored to be with these other panelists and with you all today. I could tell you, I came to the AHA about 8 years ago, and I came because I wanted to be part of a big organization that moved very quickly. And in my experience there, it always has moved quickly. We react and we are proactive all at the same time. But in my time that I've been there, I've never seen anything like this as far as how quickly our organization has had to, I don't want to say reorganize because we still have our roles, but a lot of people have stepped up into new roles that weren't even on the radar. If you talk about it at the beginning of the year. The way that AHA is structured is that we have two offices. We have one in DC that has roughly about 75 employees, and then most of our employees are in the Chicago area. We have close to 500 employees. We represent about 5,000 hospitals across the country and health systems, as well as have individual members, about 40,000 plus individual members that have various roles in hospitals, everything from the people who run the gift shops to the people who run the HR departments or run the supply chains, etc. It's such a strange feeling because I can remember being in our staff meetings in February and hearing things about what was going on overseas, but probably like many of you, never thought about what the impact would be here. And we've always had a very, very good lobbying department, a very good policy department. And the people, especially that work in our emergency preparedness area, they're always on top of knowing exactly what's coming down the pike. So you always felt like every staff meeting that you would come to every Monday, you would learn a little bit more and a little bit more. And it was like this crescendo of just events coming into play and how we could be helpful. And then it was like everything just arrived at our doorstep all at once. And there were so many calls from so many hospitals, especially the ones like in New York, New Jersey area, for instance, that had so many questions. There were so many needs because of the influx of people that were coming into emergency rooms. There was supplies, personal protective equipment for the employees. There were ventilators that were needed. There was medication that was needed. There was testing that needed to be done. And so many questions around how do we get all of these things to our members to be able to really service these patients and really help these communities out. So much on the back end working with lawmakers, not only on Capitol Hill, but also in the states and also all the localities, wanting to make sure that we had people who could get to the most needed areas. And as you know, even though the areas seem to be doing better, like in New York, there's other hotbed areas that are popping up around the country. So it's definitely a fluid situation. Our policy team is just absolutely phenomenal. They have been on so many meetings and calls with the administration, just trying to sort through so many issues that usually would take some time to really think about and work through. And just because of the need to really be able to have all of the things in place in terms of people who could be at those hospitals from different states and to get the supplies and get other things moving. I felt so bad, honestly, for so many of my colleagues because a lot of them were literally going almost 24/7 with just various small breaks in between their family life, their personal lives completely disrupted. But because of the call to serve and to really help our members, they were willing to step up. And I really applaud all of their efforts. I can't believe the jobs that they have done. And I know that for other colleagues that didn't serve in those roles, whose jobs might have not been as pressing. For instance, some of our meetings, like a lot of associations, we had to turn off a lot of our in-person meetings. So people who would usually be in charge of getting the logistics and other things done, they stepped into different roles. And so now across the AHA, you have people who are working together that if you asked me in January, do you know this person? Have you worked with them? it wouldn't have been on our radar. It's just a different feeling in our organization where we've talked for a long time about being one HA and really trying to figure out how to better connect and understand the different roles, because there's so many different roles in a big organization. And I feel like the good thing that's come out of all of this is so many people across the association have had a chance to work with each other, develop new relationships, learn about each other, and most of all, have just stepped into new roles that they hadn't even thought about in the past. For me personally, in full disclosure, and I hope nobody asks me too many questions on this, I'm not a lobbyist. I'm not a policy person. So if you have questions about those things, anything that's come up as far as CARES Act and other things like that, that is not my background, but I'm happy to get you answers from the people on our staff that could answer those questions for you. But what I do for the AHA is I do the political work, as Sherry said. I've been doing PAC work for close to 20 years, and AHA is the largest PAC that I've ever worked on. Before I do the fundraising, I work with our state associations quite a bit on raising the money. We raise over $4 million each election cycle. And so when this pandemic hit, we basically had to shut off our fundraising because with the, we raise money from our own members. So these are executives that work in hospitals. And as you can imagine, with everything else that was going on, this was not the time or the place to go asking for political donations when they were worried about making sure that they had ventilators, they had PPE, they had staffing, they had so many other needs that we just all decided to basically take a break and wait till things calmed down until we could resume our work. So in the meantime, one of the things that I did personally is I said, you know what? My PAC work has basically halted for a little while. What could I do to step up and lend a hand? And I jumped in and I had this idea of, you know what? Hospitals need help. They need to make sure that they're getting the things that they need. And as you can imagine, with the needs being so great, especially with the PPE, the personal protective equipment, that market is, we could save that conversation for another day, but the usual cost to acquire that PPE has, in a lot of cases, just really gotten out of control. And so the cost to get things that would typically say would cost $1 have gone up to $8. And you could just see that exponentially across different types of equipment that's needed. The hospitals had to close down a lot of their elective procedures. So mainly they were just taking the incoming coming into their ER, which also hurts the amount of money that they have to do their other operations. So understanding all of this that really was going on, I said, you know what, I'm a fundraiser. What could I do to be helpful? And I, outside of my work with AHA, actually had this idea for what we call Protect the Heroes, which was this fundraising idea. I had collaborated with the Creative Coalition. I've known them for a very long time, and also had had a relationship with the Association for Healthcare Philanthropy, which does fundraising in hospitals with really provides best practices for the chief development officers in hospitals, came together and said, how is it that we can fundraise and really help make sure that we get the money so that these hospitals can get their PPE and get other things? And so with that, we built a campaign and I took it back to the AHA and they were receptive to come on as a partner. And so while my practices as far as fundraising for our PAC have halted, I've spent many, many hours, day, night, weekends, etc., really working and developing this Protect the Heroes campaign. Just a real quick note on that. So Protect the Heroes, the idea was to really drive money as quick as possible to the hospital. So the website is really there so that people could search for hospitals, pick a hospital that they wanted to provide a donation to, and the donate buttons go directly back to the hospital. That way, there would be no decisions on any of the ends as far as the partners who were putting on this campaign as to how to divvy up the money and who would get it and when they would get it, etc. So we've had a lot of support, and I'd be very happy to talk more as this webinar goes on about Protect the Heroes. But for me, that was the biggest change, was just completely stopping our political work and then transitioning into charitable work to really help hospitals. But I know across the AHA, there have been similar things that have happened where there's a need, people have stepped up to really fill it. So let me stop there. I'll be happy to Protect the Heroes more as we go on.
Thanks, Sherry. Thanks. I love that story, and I love, how you have pivoted in the work that you're doing. Let's move over to Michael. Two hard acts to follow here with what J&J is doing and AHA. But tell us, in the consulting world, McGuire Woods, one of the bigger consulting firms, definitely, and the work that you're doing, how did this big change and what happened globally affect your organization as a whole and the role that you play there?
Well, thank you, Sherry, and thanks again to FiscalNote, CQ Roll Call, to Sherry and to Chris and to Mike and everyone at the FiscalNote team for being so supportive and putting together this interesting call. I would say that one of the things that we had to do immediately in the wake of this pandemic was to refocus. The main issue was, the better that you know your clients and the better that you know your organization, the more that you can assess where your risks and your opportunities are. Certainly, one of the first things that we did was, just as a firm, was make that critical decision as to where are we going to work, how do we communicate, what will this new normal look like, and that's really the focus of this question. I would say that Tony Hsieh, the founder and CEO of Zappos, focused the headquarters in Las Vegas around this concept of the three C's: collision, community, and co-learning. And that the concept of it was that people should come and go from the same doors, because that organic interaction between people spawns ideas and allows people to convene and come up with great kind of new innovations and great ideas together. With a global pandemic and all of the harm and the pain that we're seeing, which deserves an incredible amount of thought and sensitivity, but it also changed that concept of working together and being aligned in that way. So I think this concept of the three C's of being together has changed, and therefore you're really depending on your colleagues for working together and being able to focus attention on what are at the core of your client's needs. And so knowing your clients well, knowing your businesses well, means you know exactly what you should prepare for. And I would say that most notably, McGuire Woods Consulting and our group, which is an emerging technology group, pivoted immediately to not to the core issues on the excitement and innovation around technology, but how will technology help solve these problems. So we immediately began to refocus, and within a few days of there being cognition of the gravity of this pandemic, we began to get out updates on COVID, on the virus and how it would impact society. We moved and transitioned almost immediately to getting out information on personal protective equipment, testing, vaccines, return to work strategies that were going to be long-term vision for all companies. And we also began to think about which ones of our companies and clients are going to be in need of help in terms of they were going to be disproportionately impacted, and which ones of our clients are going to be in a position to help. And therefore, you never want to think about this opportunistically. On the other hand, as we've heard from the previous participants and panelists, and Chris and Sherry, their first thoughts were, how can we help, and how can we transition our business to being of service to society and to the globe? And I think that's exactly what consultants have to do at this time. So we immediately began to think about, how do we get information to our clients in a way that is concise, focused, and a part of a solution. And I think, Sherry did a good job of describing kind of how she transitioned her role. And certainly Chris and Johnson & Johnson and what they're doing has been impactful. And I would say the same for FiscalNote in terms of keeping us connected through community. So I'd say these collision, community, and co-learning events have simply transitioned. And I think that's what McGuire Woods Consulting and the fact that we have local, state, and federal groups that have all begun to share information in ways that we hadn't before, at least not as urgently. And I think with urgent times comes a refocus and an attention to which clients of ours are going to help solve problems here for the globe, and which clients of ours are going to need our help most in terms of different funding mechanisms, the vehicles that are in place before Congress and state governments, and how can we make an impact as consultants, as well as through our clients, that will have the most long-lasting and I think the most profound impact for consumers. And at the end, consumers, citizens, the globe is in need of protection, is in need of assistance in rebuilding, healing, mending. And I think this is why looking at the new normal isn't simply about what's here and now, but also how do you then employ within your effort to refocus a strategy that's a macro strategy, which is not just thinking about today and kind of the issues of revenue, the issues of assisting citizens, but also what's our long-term vision? So not just today and tomorrow, but let's re-envision what society will look like, and let's begin to focus on how we prepare for that. So again, much appreciation to FiscalNote for putting this together, and it's certainly a tough act to follow the other panelists who are at the front lines. So thank you.
Thanks, Michael. I want to circle back to each of you, just thinking about preparedness. We think about crisis communication. We have, sessions. We have communication departments that are, thinking about this, general counsels that are thinking about this all the time, CEOs and leadership in our organizations. But when you take a step back and look internally at your organizations, how prepared do you think you were? And Sherry, even in your case, hospitals, you're saying they know this stuff is coming down the pipe, but you, somebody that's hearing that daily or weekly staff meetings, really we had no idea. I think all of us would say the same thing. We just can't believe what has just happened. But looking internally, how prepared was your organization for these types of changes that they've had to put in place? And that might take the shape in workforce or logistics, or Chris, you talked about priority use and downright focus on what you're doing. And Chris, I want to start with you. Obviously, from I guess when we're looking forward, the vaccine. I don't know if you have any details to share with us on that, but how prepared were you, and moving forward, how can these things come to life easier?
Yeah, I mean, dare I say, we're relatively prepared, and some of that is a mindset, right? Being, I think to some extent, for folks that are in state government affairs as a function across the country, we understand that state governments move relatively quickly, right, compared to maybe other forms of government. And so being able to adjust, being able to be nimble, right, sort of flex in ways and build new muscles in ways, adapt. I'm probably not all that unique in saying that we are an organization, a function in U.S. state government affairs at J&J that is used to having to adjust and respond and deploy quickly. That said, I do think, sort of just the logistics of it, it's a field-based team. So practically speaking, it's a team that is very comfortable working from home. has an existing sort of network of connections that can help inform and provide information. Now, having said that, one thing that this has done is has forced us to build relationships in some areas where we haven't had them, particularly on the local government side, and also in areas of government that are directly responsible for emergency response. We had through some of the natural disasters that had occurred in places like Puerto Rico or in the Gulf states, or maybe in California, because of some of the fires previously, the natural disasters, we had established and stood up crisis management teams. Internal crisis management teams that are representative of various functions within the company, in order to ensure that issues are being addressed, that issues are being anticipated, and that we are properly informing and getting feedback from the affected internal stakeholders. And what we've done in this instance with the pandemic is deploy those more broadly. And not just in sort of those traditional venues that exist within our organization. So we now have crisis management teams that are at the local, regional, and global level that are connected and informed, and government affairs plays a leadership role in informing those crisis management teams, but also taking action items that were given to address or respond to the crisis. So we've had to, as I mentioned, I mean, also externally, building a network. I can, again, probably not unique in this instance, but having to build relationships with areas of government that you don't normally or have had a long history of working with. And so understanding those governments, the people, process, and politics of those governments or those entities, and developing those relationships has been, it's required us to learn and engage in new and different ways.
And Chris, just a follow on to that, do you think these changes that you're making and being more engaged at that local level, do you envision that remaining in place post COVID-19, or do you think that stuff retracts back?
No, I do. I think our intent is to maintain those relationships, right? So that it's a COVID crisis today, but it's for the next crisis. And what we have found in those places where we've dealt with, for example, natural disasters, that those are relationships that and understanding of processes that are really valuable. And so maintaining them, to make the investment in that now only to let them go away is a miss. So it is now might they, depending on the issue and the severity, might they become less on the forefront, but there will always need to be a maintenance. Otherwise, we'll be starting from scratch. So these aren't one-time sort of investments that we're making. We need to make them for the long term.
Thanks, Chris. Michael, do you think the lobbying work and the lobbyists in particular are now seen as more valuable to organizations that are your customers or in McGuire Woods in general than 3 months ago? And how do you see the changes that you've been forced to work under in the lobbying space change the future of your work and hereafter, even after restrictions are lifted and working to as normal?
Yeah, so it's a great question, and I think that there's no question but that it's changed the work we do, largely based on the fact that because there are the interactions between congressional staff and members of the administration have been less frequent, and the comment has been from staffers and from folks in the administration that they are simply not seeing each other as much. And therefore, much of the discussions that took place between offices and between chambers of Congress and between kind of some of the rank and file in those organizations, they've said, we need more information. So I think to a large extent, what we're finding is that relationships that have been built over many years are now the most vital to organizations. So what we found is that we are having more robust, I would say even more in-depth conversations with Congress and with the administration because the urgency of the moment requires long-term thinking, requires a very clear set of priorities. And so that has led to our practice not only shifting to critical issues for the companies, but also questions where government relations at one time viewed as a cost center. So having been in-house with Netflix and other kind of disruptive, quote unquote, technologies, the idea was we're going to move fast and break things, or we know what's what. We're the smartest of the group. And the reality is that government affairs was always something that took a back seat. And now what we're finding is that our clients are coming to us saying, we need help. And we're not even clear about how much of this works, even though we are clients, or some of the clients that are more sophisticated in terms of they've been in town and in Washington and in state capitals are saying, we understand this, but even for us, we've got our CEOs and the chair of our board, we've got the highest level people in our company saying, how do we engage with Congress? How do we engage the administration? And how well do you understand our business? So it really has been an interesting kind of inflection point for our firm in the sense that, again, we have always focused on the important aspects of our clients. So we read their 10Ks, we understand their strengths and their vulnerabilities. And now they're coming to us saying, we understand the value of government affairs and we need you now more than ever. How can we engage? And that goes to the long-term relationships that have been created by certainly our group within McGuire Woods Consulting and by companies. So I think there's a couple of things that come out of this for me that are important, which is most of our clients focused in on consumers and citizens right away. It was not so much, we're trying to get this bill passed or we need this fixed so we can make more money. It was more, we actually are worried about our employees. We're worried about our customers. How do we help at a time of great need? But also, can you help us think through our business and how we can have the long-term ability to assist in this new normal? And I think part of that for our group was technology, but the other thing was just getting on top of all of the relief and stimulus bills, understanding the mechanisms. So understanding the PPP, understanding the various funding mechanisms that existed for companies that would then help employers and employees, and then doing some larger thinking about kind of what does this mean for society, and how does our client, how does a business begin to cope under this new and extraordinary circumstance. So again, early March, if not late February, we began to see that this was going to be a trend that lasted for a long time. And we immediately started doing daily updates on COVID-19, on the coronavirus, the impacts, kind of what the administration, Congress, and others were doing, as well as at the state and local level. We then, as I mentioned before, moved to PPE, vaccines, testing, return to work strategies. But we also got very close to our clients' senior management to say, we have close relationships with the administration, with state governments, with local governments, and the federal government. And with those relationships that we've generated and fostered over time, we can help not only think about what is urgent and what can be resolved now, but what needs to be in place long term. So I think what we found is that what is often misunderstood in terms of the classic line of a cost center is now not a cost center at all, but it's one of the most critical elements of what companies are looking to for assistance. And I've never seen more companies coming to the firm saying, we're not familiar with government affairs, but we know we need it now. So, it's obviously not what you choose for. You don't want to see a disaster or a pandemic to bring focus on your industry, but it is instructive that nobody needs government affairs when they're doing very well, and there aren't any issues that you need to resolve. But when something like this happens, having a team of in-house individuals as well as outside consultants that can help navigate during this kind of rough time and terrain is certainly valuable. So I think this will be going forward. I think everyone will understand the importance of government affairs, public affairs, the importance of having long-term plans that address this. And of course, for our group, a big part of it has been kind of the state, local, federal component, which is connecting all the dots, because there's not one group that's going to solve this. And so, McGuire Woods Consulting has really been focused on bringing all those components together. And we think that it's never going to change in terms of the mechanisms that have been put in place by companies to address it.
Michael, I'm sure there's a lot of people on the line listening that are going yay and cheering you, even though we can't hear people, because the importance, as you just spoke about, the importance of the government affairs teams and understanding and being able to connect the dots. I think a lot of you said, a lot of people think of this as a cost center, but now it's something in a position or a department that has to be where the decisions are. It's critical to have that there alongside of your communications and your crisis management. It's all one thing at the moment. So I'm sure there's some cheers from the audience and hearing that. Hopefully it'll mean bigger budgets for GR shops and the ability to hire more people, because I've always found it odd that big organizations have a couple of people running state government relations across 50 states. It seems like an unmanageable task that they might have. We're seeing a lot of questions come in from the audience. Sherry, I'm going to direct this one to you. People are asking about the changes and how they're interacting with officials through virtual meetings, through teletown halls, through more written communication, whether that be, I'm seeing people ask about faxes and emails and the like, interacting with elected officials through social media. To fundraising, I'm sure we're really close to an election. How are you seeing the candidates run different kinds of events, because the fundraisers are no longer? So could you speak to how these different ways of communicating and interacting with elected officials / candidates is changing?
Yeah, thank you so much, Sherry, and thanks for the questions. Before I get to that, let me just say, I guess want to echo a few things that have already been said. First of all, I think one thing that really needs to be noted in a time of crisis is to talk about strong leadership. And we're very, very fortunate at the AHA that we've had our leaders who have been at the organization for 30 plus years and have seen times of crisis, not to this magnitude, but other things where we have, I don't want to call it a playbook, but there's protocols and ways that we've developed to work with each other and to really address the needs in a very quick manner. As our CEO, Rick Pollock, always likes to say, is that organizations need to be nimble. And I think that is the key word, is really just the ability just to be able to serve in whatever capacity is needed at that time. We also have a really great, as I mentioned, emergency preparedness department. So keep in mind that, you know, we've dealt with things like 9/11, we dealt with things like Ebola and SARS, and, you know, certainly every year there's hurricanes, there's tornadoes. So we also, from our members being hospitals, having to deal with emergency situations all the time, we're always listening to them and learning from them about how to prepare and what things to do better. But I think that this crisis has really accelerated the need for discussions and communications. And Sherry, to a point about people talking to elected officials, I think we're all trying to figure that out. I know in our organization, we have started to use more internet communities where people have chat rooms and discussions and posting information. But what I've seen is that there's been a need for these communities to pop up left and right to talk about different topics and to talk about best practices. So sometimes that means in the course of talking about how do you work with a particular legislative official, or, you know, what kind of policy, or here's some sample letters or some sample guidance in my state. We've had so many calls and Zooms and postings and listservs, and I think the communication list could go on and on, just to keep connected with our members, with our state associations, with other stakeholders, just to really stay in touch as much as possible and to really learn from each other. And that includes, you know, being able to connect with your elected official. On the PAC front, as mentioned, as far as fundraising is concerned, we basically have halted a lot of our fundraising from our members. But that still does not stop the requests from people who are running for office asking for donations. Sherry, as you said, there's an election that's coming up in just a few months, and people still need money to be able to run for office. So for me personally, aside from, you know, turning a lot of my time to protect the heroes, I do go back to the professional associations that I work with quite a bit, like the Public Affairs Council. There's been some other consulting firms that have put on some really good webinars. And there's so many organizations that deal with advocacy in general, just to get a pulse on what is everybody else doing when the fundraiser contacts you. Are you responding? Are you participating? And there have been virtual Zoom sessions, fundraisers. People are figuring out even how to send those checks. Because keep in mind, at this point, a lot of people are home. So your typical process of maybe cutting a check to a legislator, while that seems easy, or I shouldn't say legislator, to a candidate, while that seems easy, you're physically not in the office to do it. So there's been a lot of discussions about sending wire transfers or other electronic transfers, or do you just wait for another time to do it when you can get back to the office? So the dynamic has been a lot different as far as being able to really do the fundraising events. I've heard good things about it, sense that you're able to bring a lot more people into the room per se, especially when you do have these Zoom sessions. You can have a lot of members that are involved. I personally, I think I kind of have some mixed feelings about it, in the sense of I always love to have lots and lots of participation. Don't get me wrong on that. But I think what we all miss is that personal face-to-face, that personal being around each other and seeing each other, and sharing experiences and maybe sharing business cards, things like that, that just are not there right now. So there's different connections that people are certainly making. I'll just share a story real quick, just go back to protect the heroes, because I know on this webinar, we've been talking a lot about new relationships that have been built. And one of the ones that's really interesting. So two of our best supporters for our Protect the Heroes campaign, one of them, may have seen, there have been a lot of different articles written about, if anybody's seen the Dr. Fauci bobbleheads a National Bobblehead Hall of Fame and Museum that's in Milwaukee has generously given a portion of the proceeds from the sale of those bobbleheads to the Protect the Heroes campaign. And now there's not a Dr. Fauci bobblehead, there's a Dr. Birx bobblehead, there's a number of governors that have had their bobbleheads made, and now there's actually a whole group of heroes bobbleheads. So they're especially creative, and I just love it. But the Dr. Fauci, I'm sure, has been the top selling bobblehead. But who would think that the Hospital Association would have a connection with the Bobblehead Hall of Fame? Likewise, we also have a fantastic partnership with the Major League Baseball Players Association, who came to us because they felt that their players really wanted to help with the COVID efforts. And so they found our organization and they said, you know what, we know that there's a lot of frontline workers in healthcare that really need help. They need supplies, they need other things for their hospital. We want to be there to step up. So we actually have become officially part of the COVID relief efforts of the MLBPA. And that's just fantastic. I mean, I have to say, so recently on social media, there was a picture of our CEO, Rick Pollock, who was wearing a t-shirt that was related to Protect the Heroes that was put out by the MLBPA. And I just thought to myself, when is this ever going to occur again in history that my CEO is connected in this way on behalf of hospitals with the baseball players? It's just fantastic that there's people from every walk of life that are coming together to really be helpful, and the synergy is just absolutely amazing. So I'm sorry I got a little bit off track on that, but just wanted to make that point that I thought that those types of relationships are extremely valuable. And going into the future, it really opens our eyes to thinking about who else can we partnership in the future? How can we be innovative? And I know that those are conversations that are going on right now at AHA, looking to the future. And I think one of the things that's really on the minds quite a bit of our leadership is the idea of philanthropy and the idea of fundraising. Our hospitals, many of them, especially the smaller ones that don't have a big fundraising operation, they're hurting right now because they're not seeing the volume of cases that they typically would see. And it may be that people are just uncomfortable with going back to a hospital for whatever. It's a crazy time. People have different views of how they feel about COVID. And I think getting back to, you need care, we are saying, please come to the hospital. It's safe to do so. But I don't think that some of the public is there yet. So I know that philanthropy and a lot of the COVID things that we've been doing are still very much on the mind of our organization and how we're going to carry them forward in the years to come.
Okay,
Sherry, I know we're coming up on questions. Maybe just a quick 20 seconds to a point that Sherry made with regard to getting people in the room. And from a lobbying standpoint, I think one of the opportunities that has come out of this is the ability to engage policymakers in new ways that we weren't necessarily able to before, not because we didn't want to, but either because logistics prevented it or the platforms simply weren't available to us. They weren't offered. So specifically what I mean is the opportunity to bring subject matter experts in on policy discussions. Before it was either cost prohibitive or time prohibitive or just not practical to bring in subject matter experts, say into Hawaii or California or Texas, wherever it might be, for a 20-minute discussion or some testimony. But now with virtual meetings really being the norm, we've actually increased our engagements and the ability to participate in meaningful ways. And again, sort of piggybacking on the comments that Sherry made, partnering with organizations to provide those venues, so whether they be chambers of commerce, trade associations, third-party organizations, whatever it might be, to provide that venue to be able to have a conversation with policymakers, we've seen those kinds of opportunities increase substantially, and the ability to bring subject matter experts into the conversation.
And do you see that post-COVID, once everything comes back to the new normal, will this continue to be a part of that? Do you see that as a probability?
Yeah, unfortunately, I think the tendency will be to go back to the way that business has always been done. That said, I'm hopeful that we can continue to provide these kinds of opportunities, but also to maybe a previous point is that if we do go back to the way that it was, because the value that we spoke about earlier of the government affairs function and the recognition of government affairs, of the ability that we have to impact, that we will be willing to make the investment to send those subject matter experts into communities where there is need. So whether the opportunity exists there, hopefully the investment will be there.
Hey, Sherry, this is Michael. I just wanted to add one last thought before we close out. I would say that I think it was already happening, which is to say that kind of businesses were already changing, and this is obviously touches upon kind of technology. We were already seeing distance learning taking hold. Obviously, companies on the line are working on contact tracing. We already saw that there's been an incredible absorption of e-commerce. We're seeing remote working has been a critical component. Obviously, FiscalNote has changed the way we do government affairs in terms of just putting so much information at our fingertips. My wife runs a coalition called the Alliance for Connected Care, and that's a telehealth coalition. So we're using apps and a whole host of other technologies to get access to information, care, community services. And I think that it is impacting how, we launched the app coalition because people are using apps to get their content, services, and community. I think it will impact how we do government relations and how we engage as a society around critical issues that impact how we live.
Well, it sounds like we could go talking on these topics for a lot longer. Unfortunately, we're out of time. Unfortunately, we were not able to get to a lot of the questions. I'm going to ask that in the follow-up that we do address a couple of these things, because I think the panelists may want to react to that. And I think we have some resources for people as well as on our website. There are webinars that we've run that are now on demand and white papers. But unfortunately, we're running out of time. Sherry, Chris, Michael, thank you so much for taking time to participate today. It's been an insightful conversation. To the audience, thank you for joining us. We know time's precious, so we really appreciate you spending an hour of your day with us. Look for that follow-up email with the recording. We'll try to throw a few more resources with that along out to the audience as well. And again, if you'd like to learn more about how FiscalNote's helping organizations monitor the politics and policy around COVID, please go to this website that you see on the screen, coronavirus.fiscalnote.com. Thanks again, and enjoy the rest of your day.